she is not so unilaterally Republican that she's not reasonable in her positions. I think the second thing for me is Cathy listens. I've never been to a meeting, no matter how busy she is, that she doesn't take time to listen. I think the third thing for me is that she takes time to understand the issues. And so she's articulate about the issues. She's well educated, and she understands how those issues affect the people she represents. Those are not qualities you always find in representatives in Washington. The Bush administration, in its efforts to balance the budget, felt that a number of cuts should occur across the healthcare organization. For Northeast Washington, that those cuts were very significant and would have a very dramatic impact. Cathy worked across the aisle, and the legislation, actually the cuts, were either reduced or eliminated. And therefore, the healthcare organizations we had here that I was responsible for did not suffer detrimentally from that. The federal government has tried on multiple occasions to sort of sculpt a healthcare system. We do so in part with Medicare, and we do so in part with Medicaid. We create some safety nets, but what has really become a crisis is the cost of health care has exceeded even middle class ability to pay for it. And people are making bad decisions about their health because the dollars and cents are beginning to drive those decisions. So in my view, Cathy has helped as she has worked with the CHIP program, which deals with pediatric patients, to sustain that funding, the Medicaid funding, which is primarily for the poor. She's helped to sustain that funding. And then, frankly, there are a large group of older population served by Medicare need to be funded appropriately, or they do not get their care. So she's been very active on all fronts. I was chair of the Chamber of Spokane 2 years ago, and together as a business community with the Chamber, we advocated not just for health care, but for education, for Fairchild Air Force Base, for transportation, and so forth. What I thought was very interesting in that process is that Cathy could keep the issue straight, but she listened to the broad-based constituency and delivered every time when she said she would, for health care, for Fairchild, for education. So she's a responsive legislator, and I think that I've had promises before and no action. I think this is a bit of a unique area. I think it's eclectic in nature. Agricultural, timber, mining, we've got those industries, and then we're evolving economy for a much more diversified society. So I think it's important to have somebody who grasps the region, who can be loyal to our roots, at the same time be progressive enough to deal with our future. And I think it's extremely important to get somebody who is broad-minded, who takes the time to educate themselves and follows through with what they say they're going to do. And Cathy has done all of those. This will be her third term, and she's building seniority. She's been recognized by Congress as being a valuable member of that organization. And frankly, she's getting committee structures or participating on committees that are vital to our interests. To sort of go back to ground zero and lose that momentum and lose the character and the ethics of Cathy McMorris would be a significant step back as far as I'm concerned. With our organization, in partnership with Empire Health Services, we created Inland Northwest Health Services, a part of which was IRM, Information Resource Management. That has been one of the most advanced systems in the United States for integrating medical information, both in terms of quality, in terms of recording, in terms of building efficiency in healthcare, because the more you can eliminate the manual process and make it electronic and aggregate that data its usability and the ability to build efficiency into the healthcare system becomes very extensive. Cathy has been a real champion of Inland Northwest Health Services. She's helped to provide funding for that organization. She has been, as a result of what we represent here, which is a national leadership role, she has been able to use Inland Northwest Health Services to champion positive legislation for funding in that particular area. So it's very beneficial to our community. It allows us to retain our leadership position and, frankly, to build something that others can use across Washington as well as across the nation. I think Cathy understands the healthcare dilemma, and it is complex. Everybody wants a quick fix, and there is no quick fix. There is a series of things that have to occur to change the system, and controlling one entity, trying to cut costs to control the expense of healthcare, or to put a pharmacy benefit in, which is helpful, and expect miracles to happen as a result of that is just not sufficient to make this system work.